Let's stand now for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with a look at the work of an outstanding YALI fellow. Linord.
Indeed, Vincent. Nigerian Adepeju Jaiyeoba is a graduate of President Barack Obama's Young African Leadership Initiative, the YALI Mandela Fellowship. She's a lawyer by training and also a social entrepreneur working to improve outcomes for new mothers and babies at birth and after birth via mother's delivery kits.
Mother's delivery kit is a kit, like a pack, containing sterile supplies that a woman requires at childbirth. So these supplies basically are about 15 sterile items a woman requires for a clean, safe and hygienic delivery. Some of the items we have in the kit are the delivery mats, the infant receiver, the maternity pads, the mucus extractor to prevent birth asphyxia. You have the gauze, the cotton wool, the mentholated spirit, disinfectant with chlorhexidine, amongst other things.
Now, what made you think about this mother delivery kit?
So I lost a friend at childbirth, and that was my own turning point. And then moving forward and watching women in rural communities give birth on bare floors, you know, watching midwives use their mouths to suck up mucus from newborns to prevent birth asphyxia. And then sometimes even seeing birth attendants severing umbilical cord with rusty blades and even broken glass are enough things to motivate you to actually seek to change something in your society.
What was the point where you decided, let me put this kit together and let me invest my time, energy and everything I have?
I think for me it was the point where reality dawned that, you know, it could be anybody. It could be me. It could be any of my siblings. I have 4 sisters. Maternal deaths were becoming so common in Nigeria such that everyone knows one person who has died at childbirth.
How did you get the resources to get started?
Starting out, because I have a background in law, I started with savings from my salary as a lawyer, and that was the initial capital I had to inject into the business.
How did the YALI Fellowship come into the picture?
Someone mailed me that Sunday and said, oh, I think you should apply for this. I filled this form, submitted like a day before the deadline, and you know the process went on, the interviews and everything. And before then I had started putting together my seed funding and kicked off, done initial 200 kits for market sampling and testing to test market reactions. You know, so I knew I had something going. So for me, YALI was, especially as we were the first set, there was no precedent on what you stand to gain from the fellowship, other than, of course, meeting the President Barack Obama. You know, I knew that I needed a background in business. And YALI then was offering 3 tracks: business and entrepreneurship, public management, and then the civic engagement. So I applied for the business and entrepreneurship track, and I got selected, got posted to the UT, University of Texas at Austin, for business and entrepreneurship. Yeah.
Now that you've gone through the program, what can you tell me in terms of how it has changed your perception and your approach to your business?
So now, looking at the business, it's with a much more organized eye. Even though it's a social venture, you know, it's also realizing that you can build a business model around a social problem effectively. YALI gave me a lot of opportunities, not just a background in business, but also a background in global health, because I also interned at the UN Foundation with their Mama team there. And then I got the USADF, United States African Development Foundation funding for $25,000 to further expand my business in Nigeria.
And what is happening with the law?
The law still comes into play here. Because the issue of maternal and child death sometimes is really legal. Especially when you look at the issues that happens in the cities, it's more of medical negligence. In the rural community, it's more of access. Also, it's globally an issue of right. You have a right to healthcare. So the law really isn't sitting still in the shelf. It's still working. Mentally applying my knowledge in law, mixing it with my knowledge in business, global health, has helped me to build an all-round business.
What would you like to see change?
I would like to see fewer deaths. I would like to see mothers having the opportunity to watch their baby grow. I would like to see babies retaining that chance within the first 24 hours of birth to live their potential. I would like to see more opportunities for women and children in rural communities to access quality healthcare services.
And in addition to the delivery kits, Adepeju Jaiyeoba's company provides education and training to reach rural and underserved communities around Lagos and in northern Nigeria. And that's our Africa Health Report for today. Vincent?
Well, Linord, thanks a lot, and be sure to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa right here on Africa 54.